screen with the slide deck on the interpretation team.
Camilo, go ahead and share our screens in English and French. You will be sharing in your end the original, right? The French one, not? Or we're sharing all?
My understanding was you were sharing the French one, but if I need to share, I can.
Camilo, tú vas a compartir la de francés, ¿no? And you will be sharing one of the screens, right? You will be sharing the English one.
No, sorry, we would be sharing the French. I can just go ahead and share my screen.
Yeah, you share the French, and then it will appear. We will share the English and the Spanish. Right now we have both. We have English and Spanish, and then you can
Okay,
go
can you
ahead
see
and
my
put
screen?
French.
Sarah, can you see my screen?
Not yet.
Yes.
We
Okay.
are sharing English and Spanish.
Yes,
the only
and
one we don't have is the French one.
I'm sharing French. So Sarah, go ahead whenever you are ready.
Merci. Donc, pour eux qui veulent voir
Yes, we got it. We got the French.
les diapos en français, il faut cliquer sur le nom de Nika et c'est elle qui partage les diapos en français. Donc, je vais commencer. Donc, vraiment, bonjour tout le monde et bienvenue à notre webinaire aujourd'hui qui discutera de la manière
Good morning, everybody. Welcome to this webinar. We will focus on satisfying health needs of in fragile environments. This program was presented in Burkina Faso and Niger. I am the program officer, and we're going to share with you some introductory slides before giving the floor to my colleagues. Next slide, please. So during the webinar, you're going to listen to the members of each one of these three countries that are focused on the youth. But the main presentation of this webinar and the panelists of our discussion will be led by three youth leaders, participants in these three countries that work in these various and several initiatives that involves the youth. Here we have all the people that will speak today, but every presenter today is going to introduce himself or herself when it's their turn. Next slide. This is our agenda today. As I said, I'm going to present the project team, then we'll talk about our Burkina Faso team, then DRC, and lastly, Niger. And after these three country presentations, we're going to have an open group discussion. Next slide, please. So very, very quickly, our project, Momentum Integrated Health Resilience, is focused on strengthening sanitary and health resilience in fragile environment under the umbrella of Momentum's initiative. Right now, it tries to reinforce resilience in fragile contexts affected by conflicts, making an interface between humanitarian aid and development. You see the list of countries that we impact, and we have many partners and allies. Now I'm going to give the mic to my colleague, Lassana. Next slide, please. Well, thank you very much. Good morning, everybody. I am a communication specialist in Burkina Faso. You know that the project evolves in three countries in parallel that have lots of fragile environments. It's not just one, but many dimensions of fragility, global and general fragility. For example, in Burkina Faso, we have political instability, very strong. Also, violent extremism, increasing violence, internal displacements of massive amounts of people, the effects of climate change, and high rates of infant mortality and malnutrition. In the DRC, this fragility focuses mostly on corruptions, weak institution, lack of human capacity, and basic infrastructures that are given in other places, ethnic conflicts, and violent competition for resources. And in Niger, the challenges mostly pertain to nutrition security and demographics, and multiple and simultaneous climate impacts such as droughts, floods, and terrorism, and the impact of climate change. Now I'm going to give the floor to my colleague, Barth. Good morning, everybody. Thank you very much to all of you. Of course, talking about Burkina Faso, we have to with the engagement, with the engagement of the youth and the support of the project of it, we've been able to work and engage youth. The focus is to know what we have to do, what alternatives are realistic to engage and commit. The MIR project in Burkina Faso developed and deployed a series of strategies. First of all, reinforcing leadership, local leadership to energize and engage what we call young champions that will enable to identify on the ground, in the field, difficulties and work with in integration with them to strengthen their strength, to strengthen their capabilities in different fronts, technical and financial aid for institutions on the ground for the creation of the deployment of the project. And also we have the community action team in Burkina, the YCAT. We set in motion this YCAT team, which was trained. So we are expecting to see this process to evolve and to deploy several activities. Presentation of the young leader in Burkina Faso.
Barthélemy?
Marianne, ton micro est... Marianne, ton micro il faut activer ton micro. Marianne, on t'écoute pas. We don't listen to Marianne. It's very low volume, I guess. Marianne, tu peux essayer ton micro? Voilà, on t'écoute. Essaye encore une fois.
D'accord, merci pour la parole donnée. Bonjour.
Thank you very much for giving me the mic. Good morning, everybody. My name is Marianne Konate. I'm a young student on sexual and reproductive health. I was a champion in the Dibougou district. I'm very happy. I'm thrilled to be able to participate with my peers in this webinar. I did some workshops with young champions. We strengthened capabilities and skill sets and in communications, in family planning, and we've been doing sessions and educational processes. We've had reach out activities and dialogues and between parents and the community. Next slide, please. Here we see some examples of some of the initiative of young champions. It's a very important initiative. It's a combination of efforts. This corresponds to young teenagers that face different problems in the social dimension. We have high impact by unemployment. So at home in RGPH, unemployment is very pervasive. 34%, 15 years and older, and 32.7 in urban areas, 34% in rural areas. We're all the few actors, or sometimes the only actors on the ground in this district.
Sur le plan social, nous avons la faible implication.
On the social dimension, we have great engagement of young people in development programs, as you see in the pictures.
Selon la 5e enquête démographique de la santé réalisée en 2020, 20% des femmes de 15 à 19 ans ont déjà été enceintes.
We have from 15 to 19 years of age, we see that there's been, could you go to the next, can you go to the next slide? There provoked and unwanted pregnancies and induced pregnancies and clandestine abortions. Also, teenagers in urban settings are highly affected by alcohol, tobacco, drug abuse, and trauma. Women from 10 years of age to 25 years of age, and very early unwanted pregnancies and abortion. 42% have aborted when they have these unwanted pregnancies. The National Ministry of Literacy and National Education tries to promote certain programs thanks to the general guideline of in 2019 to 2020, the figures and numbers of pregnancies, scholar pregnancies went from 7,050 in 2017 to 6,000 in 2018. And this rate has increased alarmingly since 2019. It's the same situation. 49.6% of youth, and also in sexually transmitted infections are recurrent, and pervasive HIV has increased, and teenagers are increasingly consuming alcohol, tobacco, and drugs. These are some of the major problems that affect youth, and this leads to health problems that also have pervasive consequences in traffic accidents. They poor training and before driving, and youth need more training in sexual and reproductive health besides family planning. This is because of lack of communication activities and the behavior of these young people. Next slide, please. Why did we want to, these youth champions wanted to carry out activities since October 2022. We can see this in this graph. Our communication activities in the Facebook platforms, WhatsApp and Twitter, allowed to reach 21,600 people. And the educational conversations, we were able to give 14,231, education to proximity awareness to 454. Next slide, please. Thank you very much. Thank you very much. Besides these communication activities, by the way, we had next slide. Yes, next slide. Next slide. We're not in sync in the yes. Besides these activities, we organized health days, health and sanitary training, and we also participated in a survey of the homes for a community health plan in one of the districts where we did an intervention. We've also organized with the social structure of each area with young champions and formal network for reproductive health and family planning to guarantee sustainability and continuity to the end and beyond the project. And we also have a voluntary blood donation day to help ill people, and to increase proactive health. We were able to engage youth, feeling the holes in the street in the picture to facilitate evacuations and avoid traffic accidents. Centers of professionals and NGO requested these youth for special training sessions with them. We've also promoting monitoring, better monitoring and visibility. We also did a reforestry initiative called A Tree, a Young Champion, so that this health training would be much more interesting, engaging, and attractive, and convincing these youth. And we promoted together with authorities, with local authorities and community authorities. We did this in different sanitary districts of the three regions of the MIR intervention regions: west, east, west, and southwest. Central West, Central East, and Southwest. This is what I wanted to share with you about our actions in Burkina Faso. Thank you very much, and we're going to give the floor to DRC for the Democratic Republic of Congo. Thank you, Marianne. Thank you very much. And I'm Dr. Bergson. I'm a technical advisor on planning and sexual health. We have to say here that the inventory and the situation of health services and in the intervention zones of MIR here in DRC, we saw that youth had very little access to training and health services, specifically in reproductive health. So to be able to facilitate access, to open up access to these youth, we created a health services that adapted to their needs. The MIR project was able to support the Ministry of Health for the deployment of 18 youth clubs in different health zones of our project. So these were zones where youth met and gathered to talk about their reproductive health problems, and where they make proposals and to be able to improve their access to reproductive health, and we are providing health and support to these youth to guarantee effective capabilities and functionality with a quarterly plan to be able to and giving them the necessary materials and resources for training and for this behavioral change. The MIR projects bridges the communication and collaboration between youth and students that come from health institutions to give them technical support in the framework of their activities. Next slide. Very good. So this is what I was saying. When we do the analysis of the data from the Ministry of Health, from the DRC, we realize that these clubs, these youth clubs, we see an increased utilization of contraception methods. We went from 12% between January and to 17%. So there is an increase between January and so these data, we see that youth represent a good alternatives to access information in using reproductive health services in emergency situations. So when health institutions are not operating or closed, I'm going to give now the mic to another youth leader from DRC. Well, in English, it kept the French acronym République démocratique du Congo, but it should be DRC in English. Good afternoon, Benoit. Kambal. This is Benoit speaking. I come from Benila, from Beni, the city of Beni in North Kivu. I'm very interested in, I have a degree in agronomy, and I'm very interested in the youth. So these youth take on more leadership and assume more leadership to reinforce the trust and confidence in youth, so that we are in deploying a youth club in the city of Beni. Next slide. To talk about the main problems that affect the youth in the DRC. Here in our country, there is lots of problems that affect the youth, but we have to know how to prioritize. 32.8% of our teenagers from 10 to 24 years of age. This is about 23 million inhabitants, a medium-sized country. And they have limited access to education. That's one of the major problems. More than 7 million children do not go to school. Most of them that don't have enough means to pay for school. Also, a lot of unemployment and poverty expose young people to juvenile delinquency and recruitment into gangs or armed groups. And youth are are easy to manipulate when they're giving money, and there is such despair that they accept these relationships. We also have there are difficulties of parents to talk about sexual health. There's some taboos and some reluctance to speak about this, because socially it's difficult to speak openly about these problems, and sometimes there's misinformation. And we also have this phenomenon of responsible children, which is a consequence of the war, the death of different parents, and we see many orphans, many the problem, the phenomenon of pervasive street children. To be able to overcome, to maintain the situation. Next slide, please. Next. The main health problems that affect youth. The health of these teenagers in DRC are mostly related to high prevalence of HIV and STI, and lack of access to sufficient services and use of traditional products in favor of chronic infections. There is and not you using preservatives and contraceptive methods, and also early marriages. This exposes you to very early pregnancies and undesired pregnancies and clandestine abortions, and it's a domino effect. And for example, different infections, bleeding, fairly dangerous bleeding that sometimes leads to death of these girls. Also, sexual violence, physical and also psychological violence. We've seen these problems, and nutritional problems as well. Many families do not properly feed their children. We also have another factor here, which is most teenagers, even those that live in the orphans. Orphans have never heard of health services. Some of them have never heard of these services. It's not in their radar, so that they can understand and let alone understanding the problems related and the consequences related to reproductive health. Imagine if someone that doesn't have their parents, they're an orphan. Picture this: the health, the psychological state of that youth, that orphan. Imagine, just put yourself in their shoes. And the girls use products, protection products, and which are not healthy, which are not properly, they're not properly trained. We also see a great rate of toxicity. Many youth are vulnerable to drugs, alcohol, and sometimes to suicide because of their desperate situation. We also detected that these youth that use drugs use them to try to escape, to try to, and they're not able to satisfy their peers, and sometimes they think they're going to be competitive, and in the moment, at the moment of having sexual relations, and they use these drugs. So with the youth, we ask ourselves, what can we do to improve their health? Next slide. So we organized, we wanted to leave an impact and a footprint in health. So we organized different conferences, reach out sessions, conferences, and forums with experts to improve knowledge in reproductive health, and to be able to engage them and contribute with more knowledge and engage them in this process, in schools, in families, in communities, and working in collaboration with relevant partners on the ground to learn about entrepreneurial efforts and livelihoods. This can help them to be independent, autonomous, and to prevent problems related to sexual health. We also wanted to, we realized it's important to improve culture, their culture, and allow them to change the behavior, to show them that it's okay to go to these health services, that they have these tools and they can benefit from all these services, from all these benefits. We have to better develop these social media, social networks, and communication, so that they improve their knowledge and their awareness about reproductive health and services related to reproductive health, because we know that youth can use their phones much better than anybody to learn how they do so, to have access to health centers. So together with the youth and deploying this digital information, we organize and we create activities, engaging activities to guarantee full participation in the social context and in the social fabric. That's what I had. This is the situation. It's a very complex and difficult situation in DRC, and some of the things we can do and some of the things we are doing for them. Thank you very much for listening. Thank you very much for attending. For me, it's a pleasure to give the floor to the next speaker today. Thank you very much. Next, Ismail. Thank you very much to our young champion from RDC. Thank you very much. Next slide. Yes. Next slide. You're still in the previous one. You're still in the previous. Okay. We can, before this slide, can we go back to the previous one? Can we go back to the previous one? Given the commitment of young people in Niger, I am accompanied with by Ashitu, a representative, a young champion. And together we're going to share all these transforming focus on young people. The first strategy to commit and engage the youth in Niger is the strategy that we call FTP, which recognizes the needs of young people to plan activities, focus specifically of young people between 15 and 24, teenagers between 12 and 24 years, as well as their mothers-in-law and husbands. The objective of this approach is to respond to the needs and the rights of these teenagers and the young married women, so that they can use maternal health services and you have to engage the mothers-in-law and their couples and their husbands because of these behavioral restrictions and cultural aspects. And they have to understand they have these rights thanks to open discussions, thanks to the visits, home visits that we did to identify and train and equip these young communities. In Niger, in 12 comprehensive health centers in different communes, in each one of these intervention districts, we were able to identify 12 we call comprehensive health services centers in different villages, 24 villages, 48 RCOMs, and 973 couples who were benefited. And these are some of the criteria related. And also the sites that represent more vulnerability to be able to propose interventions. These controls, we set in motion the strategy reinforcing capabilities to improve the quality of the delivery of health services, increase awareness. Until 973 couples benefited, especially these, we're especially talking about these early pregnancies, couples with very early pregnancies, and the family planning methods and protecting these newborns and everything related to maternal health, as well as improving communication with the young couples. The second strategy that we used was to engage them from very early age. You can see in the image, for example, these are very young guys, very young people with different skill sets and capabilities. They actually became a group of researchers, identifying the needs of their own communities to be able to use participative action and be able to create a working plan to increase awareness and to commit and engage the community to look for solutions and to find local solutions related to sexual reproduction, to sexual health and reproductive health. We've trained 30 young people so far, all of them members of SAG. We've trained them on SAG, on gender violence and gender-based violence, resilience, and participatory action research methodologies, engaging the community, engaging also the government structure, and to help them with the obstacles they have in the utilization and access to different services. In the next few days, we're going to help them in the creation of an action plan to precisely to resolve some of the obstacles for usage and access. These are some of the most important obstacles. Lack of access and lack of use, and in this fragile environment, young people have to take on and play an important role themselves in reaching health objectives and their own growth and evolution. The experience in Niger and the set in motion of this this shows that we can transform young people with very low level of training. With little training, we can engage them in research and help them and help students to be involved. This experience in Niger, these youth people can allow us to have great results. I'm going to give the mic to a young champion to give us details about the set in motion of this beautiful experience. Thank you very much, our young champion, Ashetu Yagi Yakuba. Thank you very much to all of you. for giving me the mic. My name is Ashatuya Jagi. I'm 22 years old and I'm a first-year student, freshman. I'm members of YCAT. Since 2022, I'm an activist in a youth network that works to be the voices of young victims that have suffered gender-based violence and human trafficking. I have conducted participatory action focused on services in reproductive health, family planning, GBV. We're currently working on the development of an annual a yearly work plan for the increased participation of the youth in our community. Could you please go to the next slide? Next slide. Thank you. Some of the problems that young people face: hostile behavior by some professionals, inappropriate judgments towards the youth. There are a lot of biases and a lot of cultural problems. Certain health professionals use the wrong language and the wrong treatment, and these youth people don't feel okay. They don't feel they have access. They don't feel welcome. Also, health services seem inaccessible and are not adapted to the real needs of young people. And there is no health service that is that is properly accessible, that is fully adapted to their needs. Women, for example, feel isolated right after marriage, with domestic obligations. They're kept at home without access to social media. They seem to be boxed in and different suddenly. And when we talk about these young married people, it's not easy for them. It's a difficult life, difficult to receive information. It's always the husband or the mother-in-law, the one that says a filter to get that information. And the people that are and these two people that have access to information. That's why we have to involve these two members, the husbands and the mothers-in-law. But they don't receive enough information either about health services and some of the problem. Next slide. Yes. Other problems faced by young people, they have very early pregnancies, incredibly early pregnancies, and sometimes they're not able to reach health services. They feel a great pressure to have children before being ready. There's a peer pressure and a pressure to marry early, to have pregnancy, and health services are not accessible to population, especially for teenagers. Next slide. Next slide, please. What can we do? What can the youth do? Well, involving other youngsters and young people in creation management committees and to facilitate utilization of health services and access to health services, and to strengthen advocacy activities with community and religious authorities to be able to address these behavioral blockages and traditions and taboos, to accelerate the access to these services and the utilization of these services, to support and help the mobilization and deployment of domestic resources to facilitate access and use of these services to favor and benefit these communities and these young people. Involving young people is the best mechanism we have for handling complaints based on mechanisms for handling complaints related to gender-based violence and reproductive health and family planning. Next slide. And that's it. That's all we had. Thank you very much. Thank you. Thank you very much. I reached the end of my presentation. I give the mic to the next presenter. Thank you very much. Who's next? Next slide, please. Okay, we've reached the discussion session. a Q&A.
Ok. Merci
You
beaucoup.
can write your questions in the chat box on the boîte à discussion in the Q&A, and I see there's several
Merci beaucoup.
questions in the
Merci à
chat
tout le monde.
box. Let me see.
Alors,
Oh, I guess this congratulations everybody. Thank you very much. Thank you very much to the different. Now we're gonna go to the discussion session, and we're gonna look at some of the questions you might have. You can write your questions in the boîte à discussion in the chat box, or you can also raise your hand, and we can enable your mic. We can open your mic if you raise your hand. But can you hear me okay? And you can go ahead and write the questions. You can do it either in French or in English. You can ask the questions in any language, from Burkina, from DRC. Well, I would hope that you specify for who are you asking the question to. You can raise your hand, and we can enable your mic, or you simply can write it down. To recap what has been presented, I have a first question. To recap what has been presented by these young people for our three champions. I have a question for our three champions, and any one of them can answer. Go ahead. I see a question in the chat. I see someone raising their hand. So the first question in the chat is, this question is addressed to the DRC youngster, to see what are the biggest current difficulties in communication activities vis-a-vis the current security situation. I'm going to give the mic first to Aishatou from Niger to answer. Can you answer this first question, Aishatou? Go ahead and open your mic. So what are the challenges? What are the challenges you find in the implementation of your communication actions in the current security context lived by this area? Go ahead. Can you hear me? Yes, we can hear you. Yes. Yes, can you answer the question, Aishatou? Aishatou, you can open the mic. Yes, I can hear you. You can answer. So the question, so there is a participant that talks about the current challenge in the implementation of communication activities vis-a-vis the current security and safety context of Niger. There is there's no challenges, or everything is working well. So the security context didn't have an influence in your communications. No, there was no negative impact in our communications. These activities are in areas that are these activities in safe areas, or do they have low levels of security? These are zones that are relatively safe with fairly good security. So the current political situation has an impact in the implementation of your activities, or no? Not a high impact. Okay. So Benoit from DRC. Benoit, can you talk to us a little bit about the current context of your country, of the DRC, with all the fragilities that we talked about, and the different problems the country is going through? This impact, I would like to look at security and the impact of security in your activities. Well, thank you for the question. The challenges here are various and many, given the current situation that we live in DRC. So yes, a girl was raped, and the government, well, I mean, this area is a very unsafe situation area. This region is the people need support, more protection. For all these young people need more protection and more. And they're going through a very difficult situation when you meet with them, when you gather them, and when you talk to them. These things emerge. They need much more support in all dimensions. For example, the current state, we are in a war situation. Most of these teenagers need help. The lack of safety and the lack of security is they're completely exposed to rape and violation, and they all need support and accompaniment. Another big problem is that the community where we live, for example, the community where we live, when we teach them and give them education, they take it as a big taboo. There's a big reluctance, and opening the door to sexuality, you're there to help them, but they see you as a taboo, as some sort of there's a big bias when and a big taboo when we talk about early pregnancies, and to tell them that young people have access to these services and they can have access to these methods. It's not easy to communicate and to get acceptance, but as a young champion, but how do you adapt as a young champion? How do you adapt to these challenges that you face? How are you able, in spite of all these problems, in spite of all these taboos, in spite of all these reluctance, how are you able to adapt to these contexts? That's a question for you. Well, we are able to adapt with different type of communication. We do them between youngsters. Between the youngsters, there's more trust. A young person speaking to another young person is easier, and the communication passes better. Another thing is that youngsters, I've well, in the community where I live, they trusted in me, even though I was very young. So I was able to motivate other young people to come to these chats and to these presentations. And if they trust you, you gain trust. It's easier to bring them along and to have access. And little by little, you gain more acceptance. In the youth clubs, we make meetings in health centers. We bring them along and meet there, so that they know how to get there, and they get familiarized to going there and meeting there. And they bring along some of their children to these health centers, and they're little by little, we get them, we talk about all these things in the centers. The question was about well, no, I would like to listen Marianne from Burkina. I would like to listen to Marianne before. Marianne, could you also, surely you have some challenges in the current situation vis-a-vis communication, and how do you adapt to this changing context? Marianne, open your mic. Thank you very much. Well, our main challenge in Burkina Faso is that there are inaccessible zones where we simply cannot go. Young people in those zones don't have access to information, and they don't have access to health centers for proper health care. So young champions in Burkina Faso, to be able to face these challenges, we do outreach activities or face-to-face activities. Thank you very much. I'm going to give the mic now to Les. You have your hand up. You can activate. You can activate your mic. No, we have to activate it from here. From the. You have to activate it.
Monsieur Hakim, vous êtes là?
Camilo, tú puedes activar el micrófono de alguien, ¿cierto? De la persona que tiene la mano. Can you enable the mic, Camilo, from your end? First of all, do you see the hand? Someone that has their hand up. If they wanna, you can open the mic from here.
D'accord. On n'arrive pas à voir Monsieur Hakim. Est-ce que quelqu'un d'autre a une
Uh,
question?
we're not. Anyone else has another question? Well, go ahead and write the questions in the chat box in the chat box. Are there any other questions in the chat? You can read them out because participants maybe cannot. No, participants are not able to use their mics. You can only use your the chat box. I have a question for the three presenters. I have how can you interact with how do you interact with the community leaders and authorities? How are you able to influence the different existing violence settings and health and sexual health and family planning? I'm going to give the mic to Eshatu.
Aïssatou, vous êtes là?
Take over the mic. Aishatu, can you hear me? Aishatu, the question is for you first. While Aishatu arrives, Benoit, maybe Benoit can answer and talk about the relationship you have with authorities of the zones that you're working. How are you able to give them support to be able to achieve good impact in what you're doing? Thank you very much for the question. It's a key question about how are we able to face these challenges and respond to these challenges. For example, where I live, in the city where I live, I participated in workshops. And in these workshops, we invited the key authorities, lawyers, police officers, city people from the city, key people. We invited everybody we could think of, religious leaders, to be able to talk to them and to show them the serious problem that young people are facing, that when they don't have access to family planning, and to see how they can help us protect them against these situations, to be able to have better quality of life, so that they can have access to all family planning methods, so that they can have a real and good sexual education adapted to their age and adapted to their needs. Something more that we did is we involved in the community liaisons. We involved we involved the community liaisons and to get the message to the all the communities, to tell them, conveying the message that it was a serious situation, and that if they don't have an adapted communication, they would be victims of early pregnancies. We know that the consequences of early pregnancies lead to abortion and other problems. So the first idea that comes to mind is to abort, and the consequences of clandestine abortions are very serious and very dangerous for their health. So the project, we received help in formulating action plans, and in these action plans we learned about different topics from experts. And so young people of different neighborhoods and boroughs met and discussed about what we are facing and what are the risks we are facing, and propose solutions for the problems that we have in these communities. Well, that's a long answer for that question. It was a good question. Thank you very much. Marianne, I give the mic to Marianne. Can you tell us, Marianne, how you behaved or related to the or engaged local authorities, and how were you able to receive support in these outreach activities and these awareness raising activities? Well, here in Burkina, we have a very good collaboration with local authorities. We do promotion sessions, advocacy sessions with authorities to support them and receive support from them, so they can accompany us and support us in our different activities. For example, the International Youth Day that we organize, and and we had several authorities accompanying us, attending, and they accompanied us during all these activities. And this is one such example of this collaboration. Thank you very much. Well, thank you very much, Marianne. Aisha too. Could you activate your mic, Aisha too? Aisha too. Yes, here I am. So can you please talk a little bit about the relationship you have with local authorities and how are you able to support them? How can they support you? And if they do, how do they support you in your activities, in your communication activities? Well, with the local authorities, in most of these activities that we carry out, they support us. I'm going to give you an example. There was a conflict in a department of the country. There was a problem. There was a fight between two groups, and they weren't able to settle. And the government couldn't, and nobody could access health centers, and the health professionals were not the right ones. So we had to go to the different health districts, and we created with their help. They helped us. They helped us with fuel and with other elements, and the mayors helped us with monitoring and follow up. There were continuous fighting, and most of the activities are really have to be done in collaboration within different entities that are inside the community. So in the midst of these fights, it's very difficult to implement these things. So we receive support to settle their positions. I'd like to ask a question about it's a question about sustainability. It's a question for a champion from Niger, talking about violence in the context of security in Niger. How do you focus and guide your activities towards people, displaced people, which are victims of violations and rape, specifically? Could you repeat your question? Yes. How do you focus? I mean, in the current security context of Niger, how do you focus your activities towards displaced people, internally displaced people? That's a specific question. That surely are frequent victims of rape and violations. Okay. Do you have activities that are focused to those displaced people? Well, displaced people, we don't have activities that are specifically focused on displaced people, not specifically. So I would like to ask a question to Marianne. Do you have activities focused towards the internal displacement in case of violations or gender-based violence? Do you? Thanks for the question. Here in Burkina Faso, we carry out outreach activities to get to these people, to these internally displaced people. So we do have some activities. We've opened up we're trying to work with them in that region too. Thank you very much. Any more questions? Benoit, go ahead. In Congo, you have a special displaced population. How do you focus your actions towards these people? Thank you for the question. Here, first is to detect and identify displaced people, and they're all over the place in this region. A lot of them are and some families receive these people, and they're indirectly implied in these projects when some of these displaced people are received in the families in all these health zone. And in that zone, we have 3 clubs. And in these clubs, we those that attend, those young people that attend our engagement activities and communication sessions, we assume that these people that come are going to share with the young committee. These young people are part of these clubs in our health zones. Thank you very much. I'm gonna ask a question to the 3 of you. I begin with Marianne. Or currently, how do you see the continuity of your actions? The continuity and sustainability. How do you see the continuity of those actions to help teenagers after the end and beyond the project? Beyond the project, how do you think to do? Talking about the training, the commitment, the ongoing engagement and commitment. What about the continuity beyond the project? What do you think about that, Maria? Go ahead and open the mic. Thank you for the question. Well, we're gonna focus on sustainability and continuity strategies. We've organized a social formal network to continue after the project. We're gonna continue carrying out actions and activities, or maybe other partners might join in and join the effort. Thank you very much, Aishato. What about you? Well, in the framework of at the end of this project, what do you anticipate to do to maintain continuity? Can you hear me, Aishato? Yes, I can hear you perfectly. Can you ask the question again? The question is I want to know currently if the MIR project reaches the end, you as a young champion, what do you anticipate so that you can go beyond the end to keep it sustainable and to give continuity so that this project continues, so that these activities continues? Well, we're already in a research activity. We've carried out research. What we think of doing is to create a plan, to formulate a plan to be implemented. And since we've carried out research in the past, there are problems that we've already identified. So based on those problems, we think to continue planning and implementing these activities with the work plan. We certainly will continue working based on our plan. Aishato, thank you very much. Benoit, you have the mic. Thank you very much for the question. Continuity. Here in DRC, in our youth club, we've taken ownership of the project. So we own the project. And at the end of the project, well, I can tell you that we've already organized a group that will work beyond the project. In our clubs, we contribute, we organize activities, we teach young people tiny activities, small activities, and more jobs and works, so that the projects continues, so that we know to be able to continue working and sharing our activities, our teachings, and keep on training, so that we're able to continue. So yes, if the project would end today, if it would end today, we would continue teaching and training and continuing motivating the youth. So if it ended today, and there's some activities that we've carried out in youth clubs that we will continue. When they come, they use this opportunity to get training, and we will certainly continue doing that. Thank you. Someone can you ask your question in writing if you have your hand up? Oh, Cisga, you can ask your question. You can write it in the chat box. Well, Participants cannot open the mic. This is no, you can write it. And you write your question in the chat box. You can write the question if you have your hand up so that we can ask it to the presenters. Meanwhile, so what is enabled is writing in the chat box if you have any question. Other than that, I would like you to tell us with your, you have great experience in the MIR project. So my question is, what are your suggestions, for example, for what is how to establish alliances between NGOs and youth alliances? Can you give us some advice and some tips? Well, thank you very much for the question. In this youth club, we think that even organization that wants to work with these young people, there have to be activities that generate. In our youth club, we teach to manufacture girls how to produce bakery and cooking and these types of things, so that these young people can work independently, and if they get a livelihood and work for themselves, they will be less vulnerable, and they will have money, and they will not be vulnerable to other things. If there is an organization that wants to work with young people, the idea is to convince them to help these young people. And we've also thought that they should help young people, for example, sharing their experience, sharing experts, and transferring knowledge and things like this. We also think that when an association wants or an NGO wants to work with young people, we should define the main problems for them so that we can channel their resources. Aishato, what about you? If you would give us some advice, if you were to give advice to an international or NGO that would like to help, that would like to have a partnership with young people, what would be your advice? What would be your tips? What tips could you give us? What advice would you give an NGO that would, or an INGO that would be interested in helping young people? Okay, thank you. Yes, in my experience, if the organization that want to work and help, a recommendation I can give them is that we're already working on in activity, so we should be and the most important thing is to help us fund current activities that are already ongoing and involve young people in decision making, to see how we involve young people in different activities so that they own these activities, so that they continue and can be funded, co-funded, and continue this advocacy and this help. Thank you, Aishato. Marianne, what about you? What tips can you give us? Marianne, can you hear us? Yes, I am here. Yes, I have a few tips that I could give an NGO. I would tell them to trust in young champions, to give them trust in them. The initiative to empower and trust them, because the activities of these young champions, I mean, it's important to trust them and to gain momentum. We have very good collaboration right now. And it's, I could add to that we have a great experience and capacity of absorbing their help and using their help. So for these and other reasons, you can trust in us, because we already have experience and results that we can show. Thank you very much. Well, can you please, you can please write in your questions in the chat box, in the boîte à discussion. I think Let me see who else has a question. I don't know if you have complementary questions. Well, Aisha, while you write your questions, let me see if there is anything I haven't read or seen. Go ahead, open your mic, yes. Well, thank you very much. I believe that there's no more questions. There's no more questions. We're going to make a summary of these challenges. Il y a une question d'Edouard Ingrid Lafleur. Il a une question. Merci à tous. J'aimerais savoir quelle habitude adoptez-vous lorsque vous faites face à refus des autorités religieuses et coutumières de faire passer la campagne de sensibilisation. All right. The question is, I would like to know what do you do in case that you have a rejection of religious authority, so that you have this blockage of religious authorities about this sensibilization campaign.
Ok, je vais poser la question à nos jeunes. Alors, donc la question c'est pour vous trois, en commençant par
the question for the three of you, beginning by Marianne. So our friend Edouard asked, what do you do when you face rejection? When you face rejection of religious authorities, or to be able to carry out a sensibilization campaign or education? How do you face this blockage, this cultural blockage or religious? Yes, to facilitate this at the beginning of the project, what we always do, we have a tutor, and we find these problems, or a coach. They help us as an interface, and they help us to bridge and this situation with them. Thank you, Ashato. What about Ashato? What do you do when facing this rejection? Can you hear me, Ashato? The same question for you. Are you there? Yes, here I am. Can you please answer the same question? What do you do in case of rejection when you have an obstacle by for example, when a religious authority opposes, when the religious bosses oppose? What is the mechanism to be able to carry out your activities, your campaigns? Well, we haven't found this obstacle, because before starting, always before, we've already engaged with them. We've already talked with them before arriving. So it's key to be proactive and anticipate that for when you're going to do a sensibilization, we've already contacted before, way before. They've been informed, so we don't find. I mean, we should leave that to chance. So it hasn't happened. Benoit, what about that? Could you talk about that? Thank you, Benoit. Can you answer the same question? Well, thank you for it's a good question. There is not too many obstacles like you mentioned, because the people that oversee these live in the community. These are community leaders, and the youth clubs are linked to health centers. So we haven't received that rejection. So these young people that live in these health areas, and here we go to an advocacy workshop where we invite all decision makers, all the leaders, so that they understand, first of all, the seriousness of the problem, and little by little they're understanding what they're up against. And there's some that don't fully understand, but we hope that with time they can increasingly understand, and to show them the gravity, the seriousness, so that they understand the problems these young people are living. Little by little, they start to adopt these practices. Last year, by the way, I remember a case there was a community that organized a youth conference on well, in the midst of the Youth Day, when we talked about hygiene, menstruation, and family and sexual health and youth related topics. So thank you for the three of you. We're gonna make a last round with our champions. Last round. I would like to have a final message, but before ending, can you tell us, for example, if you had to talk to a young person in a realistic fashion, how can young people uh, uh, be serve as change agents to improve the health of their communities? How, in a realistic fashion, how can they serve as change agents and for to improve the health of their communities? So thank you for the question. The young people can be agents of change in their communities. Certainly can. They certainly can. That is true. They should, not only can, but they should. And it's a training that will transform them and allow them to evolve and transform themselves into their full potential. If the person is trained and formed with a focus on health, it's going to be easier, much easier for them, and they're going to be able to, and all the other youth around are going to be trained, and it permeates this behavior. If I want the other, I want other training, an additional training, for example, training for to invite young people, other young people, since we are, I mean, if they don't have this knowledge, we cannot do this transformation. So young people have to have access to this training that will allow to transform their community. So first of all, training is the last thing you'd like to tell us, Benoit? The last parting words. So what I would like to, well, I would like in the projects and other organizations that can help young organizations, or youth organization. I can tell you that we're always vulnerable, more than you think, but we're also flexible, and we are victims, and we fully depend from our parents. Let me give you an example. The um, the example of a person that is ill with an infection is very difficult to tell dad, I have a sexual infection. And how did you they will start asking, how did you do that? So we have to work so that is not a taboo. We have to work on this not becoming stopping being a taboo, and be able to talk about these things openly and amongst the community. So this is the first thing I would do, to focus on avoiding this, treating this as taboo, even if we're victims of social domestic violence and so on and so on. Sometimes these things are kept quiet. So after receiving this trauma, it's difficult to communicate. So to accompany young people, so that all these problems emerge and be able to be visualized and to be able to be discussed with all the health agents and parents, so that they can accompany young people in these situations, to put the youth at the center of all, because they're the future. The future. Thank you very much, Benoit. Aishato, your parting words? Aishato, the question, well, the first question, how in a realistic fashion, how can young people be change agents to improve health in their communities, and what are your parting words about this? Well, thank you very much for giving me the floor. Well, yes, young people should and should be involved, certainly, in change agents. They can be involved in different structures. of community health, becoming part of the structures and support these centers with different activities like outreach, promotion, advocacy with their peers, and be connected to these institutions. We can also involve the young people in sometimes it's difficult in these health centers. It's difficult to see them. We should bring them along and involve them there physically in these centers in activities. um, so it will be easier for other to get convinced and to explain the problems that they're facing. It's easier for a young person to see something and then explain it instead of getting explained and then explaining it. So it's better to bring them along and for them to see the obstacles in plain sight and to have access to health centers and to bring them along. So this could be a practical and useful way, doing activities at the centers, right there physically at this health center. So involving them, bringing them along, and well, to for them to see the situation. I think if we imply them, to have access to get familiarized with coming along. Well, thank you very much. What about your parting words? Yes, I think that yes, that's my last words. There's some other interesting questions in the chat, but I'm not sure, but we have little time. So I'm going to give the mic to Marianne to tell us her point of view about the role that realistically, how young people can realistically be change agents to help health in their communities. And then your parting words. Thank you, Marianne. Go ahead. Well, thank you very much for giving me the floor. In a realistic fashion, our young people will do communication activities of social change and behavioral change. Young people are increasingly more open to speak out, which is really positive. Youngsters are claiming their voice on the ground, on the terrain. They're not going to trust older people, and the activities and dialogue between parents and children and young people will help. If the initiative of young people didn't exist, of young champions didn't exist, it would be very difficult. Thanks to the partners that have helped us, I think we can continue doing what we're doing. We want with these partners to continue engaging. These workshops should not stop here. So my recommendation is to continue, that these partners, we should continue permeating and increasing these activities from young champions. Thank you very much, Marianne. And on behalf of all the organizations, I would like to thank all of you. I'd like to thank Aishato, Marianne, and Benoit. Thank you very much to the three of you for facing these challenges and opportunities for your communities. I would like to thank very much on behalf of all the projects. So that I would like to thank everybody, to all of you that have participated in this webinar. These discussions can continue. You can write to us. You can contact the responsibles of the projects if you have any complimentary questions. Thank you very much to all of you for participating in this webinar, and have a wonderful day, everybody. Thank you very much, all of you. Thank you for the participation, your questions. Thanks to the panelists, thanks to the attendees, and I wish you a very good day, very good afternoon for those of you in the other end of the world, and good luck to you all, young people. Success. Thank you very much. Bye bye, everybody. À tout à l'heure. Next slide. Could you go to the next slide, Camilo? Bonjour à tous. Bon après-midi. Thank you very much. Thank you very much. We're going to go ahead and stop recording, and we'll be sending you the recordings as soon as we render them. All right, we will be sending you the recordings as soon as we render them. Thank you very much.